Welcome friends, and in this particular session we are going to discuss some important national health programs, and as has been mentioned by Professor Arora in the previous session, first point we should understand what is the need for a separate health program for certain diseases. So here I would like to mention that there are certain diseases which are important because of high morbidity or high mortality or high incidence or prevalence, which require a sort of efforts from a group of people. So that when a disease become a public health problem, for that you require a separate program. So this is a simple thing which you should remember. You will be worried sometime you will be knowing why a particular disease has a national health program and other diseases don't have a national health program. So the basic thing here to understand is that whatever disease which has a larger public health importance in terms of morbidity, in terms of mortality or disability, we require efforts from a community, from the managers, so we have a public health program for that. And second point, you should understand that these national health programs, for whatever disease you have, they are for a limited period. So that during that particular period, say 5 years, 10 years, the disease level will be brought down and then the normal health system will take care of that. So that is the reason why we have different types of national health programs. And to discuss some of these programs, I will request Professor Gandhi. He will tell us about the reproductive and child health program and about the adolescent health program. Dr. Gandhi, please.
Before Dr. Gandhi tells that, let me tell you that if you see that as Dr. Sood was telling you about the which are that disease which we are using as a for which we are having national health programs. If you see that all the national health programs can be divided into 3-4 categories. That national health programs which are related to the communicable disease, and in that I think he has told you about that national tuberculosis control, revised national control program for tuberculosis, national anti-malaria program, and other communicable disease, vector-borne disease, and other programs are there. Similarly, we have got national health programs for non-communicable disease, which are being covered in your unit 2 of the block 2 of the course 6. And then we have got reproductive and child health, which Dr. Gandhi is going to be covering. And there are other health-related programs in which we have the minimum need program, then nutritional programs are there, and then we have got midday meal programs, school health programs, all those national health programs are there. So in this particular session we are going to cover this important topic of that RCH and adolescent health, and if there is a need, that as we mentioned that we will be having a teleconferencing session next month. If there is a request from the students, we will be covering the other national health programs in the next. So Dr. Gandhi, can you tell our learners about what is this reproductive child health program, what are the various components under the maternal component, child component, and other components, and including the adolescent health also.
Thank you very much, Professor Arora. First of all, good afternoon friends, and let me thank Professor Arora for inviting me over this session and share my views. And I'm very lucky enough to have Professor Sood and Professor Arora today. So if there are any questions from the side of RCH, they will be there to share with you also, being a very eminent personalities of this IGNOU program. To start with RCH program, before the RCH program, Government of India, we are lucky to have first family planning program in the entire universe. We were first to launch in the year 1952. But the most surprising part is, even after 55 years, our population explosion is still at number 2. We are going to exceed China in a short span of time. In the year 1977, the program was renamed as Family Welfare Program, focusing more on the fertility component and the nutrition component. Then came the year 1983, the National Health Policy was formulated. Although it was again too late, but it's always said better late than never. Then our Universal Immunization Program was launched way back in 1985-86. and then subsequently in the year 1992, CSSM program came into being. With the short background of this history, let me start with the CSSM program first, a bit about this child survival and the safe motherhood. This program was launched in the year 1992. This program was launched by integrating all the previous programs, namely family planning, maternity and child health, universal immunization program, oral rehydration therapy and acute respiratory infection, etc. There were basically three components which were associated with the CSSM program. The most important component among them was mother's health. Mother's health, they take care of the ANC, antenatal component, intranatal, postnatal care and services for the safe abortion. This particularly safe abortion was very, very important. It takes care again of the three components. Place where the abortion has to be done, it has to be properly identified and get to be approval by the National Capital Territory of Delhi if it is in Delhi. The person who is going to conduct it, they should be qualified enough or they should be properly trained enough. And the period of gestation, it should not be more than 10 to 12 weeks. If it exceeds more than 10 to 12 weeks, then the competency of the another gynecologist is taken to view and then only the abortions can be conducted. The second component is of the child health. In this, they will take care of the newborn care, oral rehydration therapy, acute respiratory infection, immunization as a whole, vitamin A prophylaxis and the anemia control. And the third thing was of the eligible couple, services for the eligible couple. This eligible couple and the target couple are very, very important from the point of view, because you see, unless until you focus on this eligible couple and target couple, you will not be able to control the population. So to control the population, this target couple is of the first 5 years of the marriage, which is very important. Then came the short approach of the target-free approach and the RCH. This target-free approach was we studied in 1996 with the basic background of community need assessment. The entire background was posed on community need assessment. The entire approach was changed. Instead of the top to bottom, it was to bottom-up approach. But most of the people, they have misnominated because of the name target-free approach. Nothing was done in that particular year, so the Government of India again rechanged the name and brought this very important program of the reproductive and child health, which was popularly known as the RCH program. This program was launched on October 1997. To be very accurate, it is 15th October 1997. So what is the difference between this RCH program and the earlier program, CSSM program? The only difference was Government of India, they have not changed these first three programs. That is the maternal part, child part and the services for safe abortion. These three components remain the same, and they have added two more components. The other two components are prevention and management of RTI, STI, that is reproductive tract infection and sexually transmitted infections. And the last part which I am going to discuss today also, that will be adolescent health. So these are the five components. In addition to the three components which you already mentioned in the CSSM, there was no change in that. Now, packages of the services under the RCH program. There are two packages, comprehensive packages and the essential packages. In the comprehensive packages, there were prevention and management of the unwanted pregnancies. There was also promotion for the safe motherhood, promotion of the child survival, nutritional services for the vulnerable group, which was also given on the top priority, and prevention and treatment of the RTI and sexually transmitted diseases. Then prevention and treatment of gynecological problems was also taken care of. Then screening and treatment of breast, cervical and the uterine cancer. All these three cancers were taken on the top priority and the screening was done. Then in the case of the reproductive health services for adolescents were also on the top priority. Next in the order was health, sexuality, gender, information, education and counseling. Then finally, effective referral system. Because unless until the referral system is very effective, we can never reach our ultimate goals. This was all in the comprehensive packages. In the essential packages, there were two things basically, management of the gynecological problems and screening and management of the cancers, which you already mentioned, cancer of the breast, cervical and the uterine cancer. Now come to the reproductive health components. This is for the responsible and the healthy sexual behavior. Then intervention to promote the safe motherhood. Prevention of the unwanted pregnancies. Safe abortion, again we have already discussed the safe abortion, again it was given on top priority. Then pregnancy and the delivery services. Management of the RTI, STI. All the referral services and the reproductive health for adolescents. Treatment for infertility and gynae disorders also. If you have to discuss about the child survival elements, the important features are essential newborn care, prevention and management of the vaccine preventable diseases, urban measles campaign, neonatal tetanus elimination. This is the top government program these days because we are going to eliminate neonatal tetanus very shortly. Surveillance of the vaccine preventable diseases, cold chain system. Unless until we maintain the cold chain system, we cannot receive the vaccine preventable disease cannot be taken care of. Polio eradication is our top agenda. ARI control program, acute respiratory interlude control program, diarrhea control program, and the ORS. Prevention and control of vitamin A deficiency, that is also taken care of the child survival elements. Now if you have to discuss the adolescent part, the definition which is given by WHO is period of the life spanning the ages between 10 to 19 years. If you look into the ICDS program, they also identify the age of the adolescent, that was 11 to 18 years. But WHO has defined the clear cut, it's from 10 to 19 years. It's a period ranging between childhood and the mature adult. The word adolescent is derived from a Latin word adolescere, which means to grow, to develop. In this period, there are a number of physical, cognitive related to the skill development, social and emotional changes take place in our entire body. Since adolescent health components of two components, adolescent and the health, I would just like to give a brief of the health, which everybody knows according to the WHO definition. It's a state of complete physical, mental, social and spiritual well-being. It is nothing but absence of disease and capacity to lead a socially and economically productive life. We'll have to take care of another component, that is a positive health and the quality of life. Quality of life is nothing but it's a comparative measure as perceived by the individual, or it can be a group, namely happiness, satisfaction, marriage component, financial situation, education and self-esteem, etc. Then we require appropriate blending if you want to be really successful in our health component. Appropriate blending of proper function of your body and mind. We labeled as a biologically, socially and psychologically you should be active. Now in the case of adolescents, the challenges in front of us are breaking up of these strong family bonds. We have got two types of family system. It can be a nuclear family system or it can be a group system. Both the system has got the advantages and the disadvantages also. The new pressures on the growing child are due to the financial inequality. Number two, there is increase in competition. Since this modern era, there is a lot of awareness compared to our age. There is a lot of competition because there is still competition. Most of the people, they have gone to the literacy. Then there is a difficulty in the job opportunities. Apart from there are so many opportunities available, but it is very difficult to get the job opportunities in this present era. They are more prone to drugs and alcohol. All these, in this present era, most of the children, they will be more prone to the drugs and alcohol if they are kept in a wrong society. Early premarital sex and teenage pregnancies. Recently there was an article in the Hindustan Times and Times of India about a week back. In Delhi itself, the survey which has recorded the early premarital sex was to the tune of more than 50%. And there will be subsequently a lot of teenage pregnancies will be associated. Seeing these challenges, there will be a lot of phenomena of depression due to the stress factor of failures as well as the competition. And secondly, there will be increased morbidity due to the violence and behavior. Because these children, they are more prone to violence and behavior if they are fallen the wrong trap. Now, looking into these challenges, we have to meet these challenges. See, meeting these challenges is not an easy procedure. It is a complex issue, so combined efforts are required, not only from the individual, it is required from the society and also from the health providers. It's a combined effort. It's a combined effort from the school, from the colleges, from the parent side and from the society. Importance of visual and the print media. The era has come where the 24 hours visual media, that is a TV channel, can be opened up. The TV channel has got a lot of good information, including the science channel, geography channel, but then most of the children of this era, of this teenagers group, they would not like to see this channel of this geography channel or science channel. They will be more prone to the other channels, movie channel and the fashion channel. So individually has to decide, although there are very good channels available, it will much depend on the individual person which channels you want to take care of. Then we have to create adolescent friendly services which are easily accessible and flexible. Whenever the friendly services adolescent they are going to open up, we should have taken care of these two components. It should be freely accessible, that means it should be available, and it should have got a flexible attitude. Flexible attitude, most of the students they are going in the evening classes and 70% of the students they are going in the morning classes. So these adolescent friendly services should be opened up in the morning as well as in the evening. And the composition of this adolescent friendly health service should be one gynecologist, one pediatrician and preferably one psychologist. If not psychologist, we can take care of a psychiatrist can be also of help, including the medical social worker. Then there's a great role of family in nurturing this adolescent health component. We say the formula is of the 3S environment. 3S stands for safe, secure and the supportive environment we have to give to these children. Then there should be no discrimination in the gender. Even we are staying in the capital of Delhi, we are sorry to say in the capital of Delhi also people do differentiate between the male child and the female child. So now the era has come that there should be no discrimination in the gender. Of course in the rural belt there's a lot of discrimination in the gender. Adults should become a role model. The saying is that whatever we practice, whatever we preach, we have to practice also. Then only you can become a role model. Unless and until you practice yourself, you can never become a good role model. Then street children. Whenever WHO has discussed about this adolescent health, they were more concerned about the street children. These children who are born and brought up on the street only. So we should not be taking care of only the children who are born and brought up at the home. They should also concern about the children who are brought up on the street. So WHO is more concerned whenever we talk about this adolescent health, the person who are born and brought up on the street children. Then welfare, spiritual, religious and the judiciary, they can also play a big role in the management of this adolescent health group. Welfare, religious society, if they are good enough, they can impart a lot of education. They can impart a lot of good things to the society and then you can bring about a good adolescent health group. Further, adolescent health can be divided into male and female. Adolescent can be a male, adolescent can be female. Adolescent can be a boy, adolescent can be a girl. We again further divide into adolescent early, middle and late. Because when we say adolescent health composition is of the 10 to 19 years, adolescent who is of the 10 years can be fit into 10, 11, 12 can be fit into early, and who are in the late they can fit up to 17, 18 and 19. Those in the middle, they become to the middle group. Adolescent can be school going, there are so many children who doesn't go to the school at all. But there are so many children who go to the school and later on they become in the dropout category. If they go to the school, later on they will get fixed up in the literate category. If not, they will go into the illiterate category. Adolescents who are studying the rural area will be known as the rural area adolescents. Those who are studying the urban area, they will be known as the urban adolescents. Adolescents in the rural area, they get married very early, so they can get married adolescents. And those who are not married, they can be labeled under the unmarried adolescents. Adolescents who takes care of the nutrition very well, they can be grouped under healthy nutrition, so they can be grouped under the healthy adolescent health, and those who don't take care of the nutrition, they can be fit into the unhealthy adolescent health. There is a phenomenon of obesity also. Obesity in the developing countries, there is a problem of the undernutrition, malnourishment. But in the developed countries, there is a problem of the obesity. So we'll have to take care of both the obesity as well as the malnourished component. Most of the children to start with, they will be introvert, but later on they become the extrovert also. But there is a phenomenon of vice versa also. We can again divide adolescents into good kids and the risk takers. These risk takers, they are popularly known as the pleasure seekers also. So if they fall in the wrong trap, they will become in the pleasure seekers. We should educate our children to be fit into the good kids only. Then comes the puberty. In the puberty, if you liberate adolescent population in our country is 20% of population. If you want to be very accurate, it is 21.8% of our population fits into this adolescent category. That is 1/5 of our population. It's a major chunk which fits into this adolescent health group. So government and everybody has to take a lot of care on this adolescent group because we form 21.8% of this group. Puberty further can be divided into 3 phases. Puberty is nothing but it's the onset of secondary sexual characters. We further divide puberty into 3 components: pre-pubescent, pubescent and the post-pubescent. As you all are aware of that, the girls' maturity starts earlier than the boys, at least by 2 years. In the pre-pubescent age group, the girls' maturity starts from 10 to 12 and for the boys it is 12 to 14. In the pubescent group it is 12 to 14 for the girls and for the boys it is 14 to 16. In the post-pubescent group, the girl age is 14 to 18 and the boys age is 16 to 20. It is nothing but the development of the secondary sexual characters. If you have to underline the physiology developing this adolescent health group, it is nothing but it's the reactivation of the hypothalamus, pituitary and the gonadal axis. With this reactivation, there is a release of GRH, gonadotropin releasing hormone. Once there is a release of the GRH, there is a gonadotropin production in abundance. Once it is produced, it is released in the hormones is released in the bloodstream, and onset of puberty takes place. Now, if you have to see the historical background of this adolescent health, World Health Assembly way back in the year 1989, they highlight the needs of the adolescents. Prior to that, nobody talks about this adolescent health. So 1989 was the dawn of this adolescent health when for the first time World Health Assembly they have highlighted the needs of the adolescent health. It was again re-emphasized by ICPD, International Conference on Population Development in Cairo, in the year 1994. They have again re-emphasized the importance of the adolescent health. WHO in the year 1998, they has declared 1998 as the year of the adolescents. Undernutrition is a major health problem in the developing countries, and obesity and the overnutrition is the major health problem in the developed countries. The WHO has said we have to focus on the children basically living on the streets. If you have just to take the introduction part, this adolescent health is nothing but it's a period of transition from the childhood to the adult. Since we said this component consists of 21.8%, there's a very important group, and our future of the society depends entirely upon this adolescence, which normally accumulates to 1/5 of our population. It's a crucial period of life, and there are myriad of changes. It's a preparation for the parenthood, because most of the children, they get married by this time. The health problems are totally different from other children, because in the younger children age group, they are normally suffer from acute respiratory infections, pneumonias, and the diarrhea only. While the elder age group, the problems may be of CAD, hypertension, diabetes mellitus. But this age group normally suffers from the behavioral problems and the sexual problems. They are more prone to behavioral and the reproductive problems. The basic thing is because of the lack of the information, guidance, and the counseling. Now, Government of India has started this program in the schools also, and the education will be imparted from the 6th standard onwards, which is popular known as the US school information. Most of the teachers will be trained for that first by a group composed of gynecologist, pediatrician, and a counselor. And there's a one guideline also for the girl students. The training will be imparted by the lady teachers only. If you have to discuss about the physiological changes, puberty in the girls, it starts around 10 years, maximum growth will take by 14 years and continue up to 19 years. The appearance of the secondary sexual characters is the mark of this puberty in the girls. There is accelerated rate of the genital organs and the appearance of the hair and the breast. That is all the development of the secondary sexual characters takes place during the puberty. Menarche. Menarche is nothing but the first onset of menstruation. This onset of maturity starts around 10 years. There was a study conducted. They say the latest the trend has come down to 10 and 11 years, which is still thought to be physiological. In some of the countries, it's reported to be 9 years of age even, but most of the people think about that still is a pathological phenomena. But if it is of the 10 or 11 years age, it has become a normal physiological phenomenon. Good nutrition status will lower the age, and in malnourished children, it will delay. It will delay by 12 years, 13 years, and up to 16 years even. If menarche doesn't set in the puberty girls by 16 years, one should consult a doctor. Maybe some pathological reason may be associated with it. As you all know, menarche is nothing but once in a month for most of the women. It's a continuous process. It's nothing but a physiological phenomenon, except it's a temporary stoppage during pregnancy and the lactation. But it will stop permanently at the time of menopause, which may range from woman to woman from the age of 45 to 55 years. Some of the women may have early menopause from 45 years, some may carry on up to 55 years. This was puberty in the girls. If you have to discuss puberty in the boys, it takes place later than the girls by around 2 years. It is characterized first by the change in the voice, then followed by the growth of the hair and the development of the genitals. All these changes are normal, natural, so one should not be ashamed and frightened. But this can be taken care of if the parents and from the school, the education is given right from the childhood, right from the 6 years of age. The growth spurt. There was a study which has been conducted out during this span of the 9 years, from 10 to 19 years. There will be increase in the height from 24 centimeter in the case of the girls and 36 centimeter. This is a study which is carried out, but it doesn't mean that all the girls and boys will have increase in height of 24 centimeter, so it's a variation. Again, in the case of the higher weight, it will vary from 21 kg in the case of the girls and 25 kg in the case of the boys. But then it may vary from girls to girls and boys to boys depending upon the nutrition level, and there are so many environmental factors which will play a role. If you have to discuss the psychological and behavioral changes, most of the children, they may develop anxiety and apprehension. But this development of anxiety and apprehension can be easily ruled out if there is a cooperation at the school, cooperation at the college level, and cooperation from the society as well as from the parents. It's a time for exploration and the adventure of one's own body, because there are so many changes which are going to take place in our body itself. These changes can lead to confusion, addiction, and a lot of risky behavior if we are not properly counseled about it. Most of the children, they will hesitate to communicate about this sexual development. That's why if this curriculum is started, which you call as the sex education, the sex education we'll discuss it later on. If it is started from the school level, right from the age of the curriculum of the 6th class, it can be probably sorted out, and most of the children can be taken care of by the proper education and counseling. They require nothing but the information, education, and knowledge to be imparted right from the childhood. Socio-emotional changes. There will be a lot of swings in the mood, ranging from happiness to sadness because of the release of the hormones. Most of the time, the children will be uncontrolled in the emotions. There is a merging of the sex type, which is a normal physiological phenomenon because of the masculine factor and the feminine factor in the case of the boys and the girls. It's a common phenomenon that the males will be attracted towards the girls and the girls will be attracted towards the boys. So it's an attraction towards the opposite sex. Infatuation at this age is very common with the selected person.
Yes, Bangalore, please come up.
We are more interested in health administration and hospital management in that angle.
Okay, we'll be coming to that. I think once the concepts are cleared, then we'll be coming to that also. We'll take up that, madam.
Okay, thank you.
After I finish, I'll request Professor Sood to take care of that element.
You can continue.
Please continue.
Regarding the nutrition component, adolescents need more calories and nutrition to be spurt in the growth and the physical activity. If there is a lacking in nutritive value, it will result adversely on the growth of the child. Nutritional deficiency will result in retard in physical growth, it will impair the cognitive development, and it will delay the sexual maturation. There is an effect on all the three things: physical growth, impair the cognitive development, that is the IQ, and there is a delay in the sexual maturation also. So emphasis should be on the good nutrition and the healthy eating habits. That is a well-balanced diet. Regarding nutrients, we can divide into two components: macronutrients, which will consist of the carbohydrates, which constitute 60%, the fat components of the 15%, and the protein components of the 25%. The second component is of the micronutrients, which will cover all the vitamins and the minerals. As I have already said, overnutrition is a major problem in the developed countries. While in the developed countries there is problem of the malnutrition. Now, what are the effects of the overnutrition? It's an emerging problem and need to be curbed. If we don't take care of this emerging problem, we are vulnerable for obesity. And the other diseases associated with this are diabetes mellitus, hypertension, and the coronary artery disease, which has linked up with this obesity problem. Since this in modern era, the children are very fond of the fatty junk foods. If they are associated with fatty junk foods, if the child is not taking the physical activity in usual, it will be the major cause of the obesity. So if you have to decide the obesity, there is basically two components. It is the fatty junk foods and the lack of the physical activity. Dietary guidelines for these kids are: eat variety of the foods, balance of food with the physical activity. That physical activity component is very, very important if you want to remove the obesity. Diet should be rich in vegetables, fruit and grains, and choose a diet which should be low in fat and the cholesterol. There are so many junk foods which have been labeled to us, but I'll just label one of the 8 worst junk foods which are most dangerous to the developing age group of this adolescent health. Colored flavored drugs, white flour products, all the maida products which are very dangerous, cream rolls, pastries and the chocolate bars, candies which are heavily salted, snacks foods which are heavily salted, ice creams, flavored potato chips, and the food drinks. These are labeled as one of the 8 worst junk foods which most of the children at this age they are very fond of taking, both in the morning breakfast, lunch as well as the dinner. Their food will mainly consist of these junk foods only. Next component is of the personal hygiene. The basic requirement for health are care of the teeth, tongue, hands, groin and general area to prevent the infection. Menstrual hygiene for the girls, and age of the menarche. There is a study which has been conducted way back in the year 1840. The age of menarche was 17 years. There was another study conducted way back in 1990. The age of menarche has gone down to 12.5 years. The latest study which has been conducted in 2000 years, as I have already told you, the age of menarche has gone down to 10 to 11 years. Then there are unprotected sex and unwanted pregnancies. There are 3 components in this. The first component is ignorance and the unprotected sex. This will be common in all the 3 categories. If there are unwanted pregnancies, it will lead to abortions and it will lead to mortality. Again, in the second component, if the ignorance is there, unprotected sex, there will be a lot of teenage pregnancies. I already said teenage pregnancies to the tune of more than 50%, even in the city of Delhi. There will be a lot of deliveries. If there are a lot of deliveries, it can link up with maternal and the fetal mortality. ignorance. If there is ignorance, unprotected sex will be there. Now this is the era of RTI, STI, HIV and AIDS, so people should be educated for this. This may lead to infertility, pelvic inflammatory disease and ectopics also. There is a formula to prevent, how to prevent all these unwanted pregnancies and unprotected sex. The formula is of A, B, C, D and E. A simply stands for abstinence. B, you should be faithful to your partner, being the era of the AIDS and HIV. Use of the condom, that is the contraceptives. Delay the marriage. There is a study which has been carried out. If voluntarily both the girls and the boys delay the marriage by the 3 years, there can be a lot of improvement in the population expression also. Government of India described the age as 18 and 20 years. If the girl postponed the marriage by 3 years, say 21, and the boy postponed the age by another 3 years, 24 years, there can be a lot of control in the population also. The last component is the emergency contraceptive. Then there is a role of family and the community. There is a crucial role in the shaping the behavior. As I have already told you, we have to ensure the 3S environment: safe, supportive and the secure environment. Information and education to be given to the family members, those family members who are not educated. We should always keep the positive attitude in mind. That is, a motivated adolescent can influence the counterpart. Health problems normally associated with this age group are obesity, anemia, goiter, injuries, infections, mental health problems, basically anxiety disorder and depression, which are very common in this age. Adolescent violence and the sexual abuse to the tune of 3 to 29% in the case of the males and 7 to 36% in the case of the females. But most of the problems related to the health problems are anxiety problems and the depression problems, sexual and the behavioral problems. So if I have to sum up, the salient features of this are, it's a transition period between a carefree childhood and the responsible adulthood. It's a period of change, and the change induces fear, confusion, stress and strain. It's a period of exploration, experimentation and the risk-taking behavior, which is the hallmark of this adolescent health. It's a rapidly growing segment of the world population. As I've already said, 21.8% of population is the adolescent population. One is to infuse self-esteem and the self-confidence from the parent side and from the peer group. Instill desire to become economically independent as soon as possible. Special focus to become a responsible citizen. These children, they are our future. They are dreams and hopes, men and women of tomorrow. They are the key factor for the future health, and the problems are unique, so they are to handle with care. They demand independence, yet they are dependent upon their parents. Maximum hostility shown to the parents, and maximum rebellion shows to the parents, mostly to the parents. But most of the time, they take care and they would like to be taken care by the parents. Now I request Professor Sood and Professor Roy to give highlight on RCH as well as the adolescent health.
Thank you, Professor Gandhi, for giving a very comprehensive view of the components and the objectives of the adolescent health and RCH. I think in a very comprehensive way he has told you about what are the various maternal components, various child components and various sexual components, and also in detail he has covered the adolescent health, which is not given in the module. That was the basic idea. Now in next 10-15 minutes we can focus our discussion on that what is the role of hospital administrators, what is the role of what are the various managerial issues in the national health programs, including the RCH program also. So maybe we can divide our discussion into that, what are the various managerial problems and what is the role of hospitals in the national health programs.
Thank you, Professor Roda. I think one point which I want to emphasize here is from your examination point of view also, this is a very important area, because one of the questions which came from Bangalore is how this question or this national health program are important from examination point of view, and what is the role of hospital and health administrators. So this is just a tip I want to give to the student, because definitely we will find one question on national health program. It may be a full question or maybe a part question. So when you are preparing for attempting this question, you should try to keep 3-4 points in mind. You can begin with the introduction. In the introduction, you can highlight what is the magnitude of this problem, why national health program has been started for this particular disease. For example, if a question is asked about National Tuberculosis Control Program, so you can begin with the introduction. You can highlight the importance of tuberculosis as such. You can say that about 14 million people in our country are suffering from tuberculosis. Every year 2.2 millions are added and nearly 5 lakhs people are dying of tuberculosis. So this highlights the importance of this issue. As I said, for most of this national health program, there is a separate program because they are public health problem. Why public health problem? Because of their morbidity or mortality. So then you can focus on briefly about the historical development, as Dr. Gandhi mentioned about the RCH program, how it has evolved over the period of time. We started with family planning program, then family welfare program, then shifted to CSSM program, then target free approach, and finally this RCH program, phase 1, phase 2, and now phase 3 is coming. So we expect from you, you should write in brief how this program has evolved over the years. So similarly, taking the example of tuberculosis program, for example, it started in 1962 as National Tuberculosis Control Program. Then because of defaulter rate, modification was done and it was revised in 1992. And we introduced the new concept of directly observed treatment with short-term chemotherapy, the DOTS therapy. So this is the second part of your question, should indicate how the historical development. Then third portion should indicate what are the goal and objective of the program. What we really want to achieve, because as I mentioned, all these national health programs are time-bound activities. They are supposed to be there for 5 years or 10 years, and naturally whenever you have a time-bound activity, there has to be operational targets and goals. So then you can mention about what are the goals and objectives. Taking the example of tuberculosis, our goal is to achieve at least 85% cure rate among all the sputum cases which are detected. So that means this is one goal, and second goal is to detect about 70% of the new cases in a community. So like that, for all programs you have goals. So you should mention in sequence 2 or 3 goals for which are there. The next step is what are the infrastructure and strategies. What are the sort of infrastructure which is envisaged under that particular program, and what are the implementation strategies. So these implementation strategies you can think of starting from the periphery. Periphery mean at community level intervention. Maybe it could be health education activities, maybe it could be immunization activities, maybe it could be strengthening of the primary health centers or sub-centers, maybe it could be involvement of the local practitioners, or it could be increasing awareness using mass media. So intervention could be at the primary level, or it could be at the primary health center or community health center. As Professor Gandhi mentioned about this maternal component, abortions, facilities of abortion under RCH, maybe in certain community health centers, opportunities for institutional delivery at primary health centers. Then you can think of the secondary and tertiary level institution, because in tertiary level institution you will have to have training of the manpower. Like you have to build in manpower, giving them competencies, either to health workers or to the medical officers who are managing these facilities. The next component could be the deficiency in the program. So because we expect you to do the critical analysis also, because all these things are given in the book, but we also expect in the end you should give the critical analysis, what are the deficiency in the program and what are your suggestions. Now this is important from the management perspective. So unless you are able to analyze the infrastructure, facilities, goals and budget and all these strategies from a management or administrative perspective, you will not be able to get better marks in. And this is a very important area as well as the national health programs are concerned. As Professor Arora said, you can think of these as national health programs for communicable diseases, where I gave the example of tuberculosis, malaria is another, HIV AIDS another, or it could be in terms of non-communicable diseases. With the changing pattern of lifestyle, with more people and environmental pollution, agent, host environment axis shifting, we are having more of now the non-communicable diseases. And there are special programs for non-communicable diseases, for example, for mental health, diabetes. People say that diabetes is such a high proportion that perhaps India is going to be the world capital of diabetes.
Yes, in the coming years.
Yes. Then like other diseases, coronary artery disease is coming up, hypertension is coming up, cancer control for example is another important area. Cancer is going to be a big problem in the coming future. So like that you can think of a national health program in communicable diseases and non-communicable diseases. And the point which Dr. Gandhi mentioned is adolescent health is very important. You can either get a short question, short note, or even you can have a say detailed part question of a long question also. So I think the purpose of this particular section was to sensitize you, especially those of you who are working in a clinical setting. Especially when you are working in a hospital setting, you tend to ignore the national health program. But in one of the important I think question will be on the national health program, either as a part component or it could be a full question or even it could be a short note. Now the question is how it is the role of hospital in the National Health Program. As I mentioned, if you look into the strategies from primary, secondary and tertiary level, the hospitals will usually come in the secondary level. Secondary level institution will be the district level hospital, and tertiary level hospital will be the state hospital or medical colleges. So all these have a very important role, especially the tertiary level hospital can prepare the manpower, like doctors, training of the doctors, training of the other person. They can test the new strategies for the program. Okay, this is a treatment regime. The research component can be taken care of. Then they can also help as a referral for the complicated cases, because for example tuberculosis, there could be a drug resistant tuberculosis. For that you require either the secondary level institution with facility or tertiary level institution. So the hospital, although they are largely managing the clinical, playing the clinical role, but they can also play preventive role in terms of, as I said, giving very important inputs in terms of research, in terms of suggesting newer strategies and training of the manpower. And also in the hospital setting you can have health education activities. Say for example, when the patients are waiting for consultation, now in most of the hospital they have TV, closed circuit TVs, and they can use this for learning opportunities.
Another role which I emphasize is for the hospital, that they can play in the surveillance of this disease, and they can act as a surveillance center for this particular disease.
Very right, because certain special sort of surveillance activities, especially there's for certain tests are required, facilities may be in bigger hospital. So hospital have a very important role in National Health Program in terms of monitoring and doing the surveillance part of it. Then program managers also, they have an important role in terms of monitoring the program, because sometime you may get a question as a district health officer or a medical officer posted in a primary health centers, how will you sort of monitor the program at that particular, they may give a sort of example. So there is a chapter also on monitoring and assessment as evaluation of different programs, so that under management component perhaps to some extent it has been covered. So that is another area for you as a health manager, because you are getting routine reporting coming from primary health centers or maybe from the sub-center. So you have to sort of interpret the data and draw conclusion whether the program activities are going on as per the envisaged activities in the program, if there are deficiencies, where the deficiencies are in terms of manpower or resources or equipment.
And you can attempt only when you are, as Dr. Sood is mentioning, that how this program is being monitored. So for that you must know that what are the various components and what is the implementation strategy. Once you know what are the various components and how the program is being implemented at the grassroots level, only then you will be able to answer that whether this program is being monitored properly and whether it is delivering the results which is desired out of it. So I think these are the important managerial issues that one need to be monitoring and evaluating of these national health programs at own level. It's not necessary that we have to do at the tertiary level or it has to be at the center level. At whichever level you are working, even at the primary level, secondary level and tertiary level, people have got their own role to play in their own setup, and within their own limitation they have got a certain role to play in that. Any other managerial issue would you like to add?
See, management, the main challenge for a manager is to manage within the resources. So resources will always be constrained.
How to apply the available resources at the particular level
utilize it.
And nowadays I think another important resource could be the community itself, which very often we ignore. The involvement of the community or participation of the community is also very important, and especially if you are working in the communities, you can generate a lot of resources by involving the communities. Many a time we think that the communities cannot contribute, but the studies have shown that if they are properly educated and they feel that the program is for them, they will come forward with the resources. Could be in terms of manual labor, could be in terms of local resources, facilities. So that point you should also keep in mind.
Especially the role of Panchayati Raj and Panchayati Raj, local self-government, they can also, if they are involved in the implementation and planning of these programs, they can also play a very important role in that. So I think these are the things, these are some of the managerial issues and some of the role of hospitals. So this surveillance, central center, then training, research, then IEC, health education, as Professor Sood told you. These are the important, involving community, these are the important roles of a hospital manager in these national health programs. So whenever you are attempting question, if there is a question on any program, so these are the common things which you can utilize, and then you can apply these 4 or 5 things pertaining to that particular program, that how, which type of health education, which type of training, which type of research has to be done for that particular program. So I think there was a call from Bangalore. I think this will answer your question. And as we have shown you that we will be having next teleconferencing session on 18th of November from 11 to 1:45, and in that we will be covering some of the areas which we have not been able to cover in this teleconferencing session, and maybe if some other areas you want to cover from course 1 to course 5, any important area which you feel, you can email to me, and then we'll call the experts of that particular area and try to cover those. So with these words, I thank Dr. Gandhi, Professor Sood for being with us this morning and giving very useful inputs to our students. And I think the students sitting at the various regional centers must have been benefited by the inputs given by our experts. And we look forward to your feedback on this teleconferencing sessions, and also the questions or queries which you would like to have in next program. With these words, we come to end of this teleconferencing. Thank you very much.
Thank you very much.